What motivates me to come to work every day is my patients. They're resilient, and that's something that we try and work with patients to bring out in them. One of the first questions we ask in many of our interviews is, what are the things that help you get through difficult times or circumstances, and how can we tap into those to address whatever the issue is that we're dealing with in clinic that day? I'm Dr. Ryan Pasternak. I'm Division Director for Adolescent and Young Adult Medicine here at Children's Mercy. We focus on that developmental stage between puberty and adulthood and addressing the multitude of issues and conditions that come up in that area. Those include everything from disordered eating to menstrual disorders, puberty problems, male genital urinary issues, as well as substance use, vaping, nicotine use disorder, acne, really the whole gamut of things that young people deal with. A big part of what we are also doing and the way that we're coming to our work is we're trying to meet teens where they're at and young adults where they're at and address those issues in a way that helps them become safe, healthy, responsible adults. We do deal with a lot of topics that can be uncomfortable for patients, for parents, for them to talk about. So part of our role there is to be a facilitator for those conversations. We're going to always try and spend some time one-on-one with our patients just to give them a safe space to talk, but also that's our way of giving them the opportunity to learn how to have those conversations with healthcare providers about difficult topics, so that by the time you're an adult, you're versed in those discussions and those conversations rather than never having a private conversation with a physician until you're in your 20s. Some of the ways I can tell I've done a good job when I see a patient in the hospital or in the grocery store is when they come up to me, oftentimes just going, Dr. Pasternak or Dr. P, how's it going? It's so good to see you. Or thank you so much for what you did for my child. And sometimes those are long journeys for our patients and families. Some of the issues we deal with are difficult and hard for them. And sometimes they don't feel that way when they first come to see us. And oftentimes when they leave, they express a great deal of thanks for being able to engage in services with our team.